Choi, and I'm going to be presenting case 401. So we have a patient here who's coming in with shortness of breath after he's been exercising at 5 a.m. in the morning. He's having shortness of breath, fatigue. His blood pressure is continuously going lower. He's diagnosed with a flutter. So in the emergency department, since he is a hemodynamically unstable, we would do an immediate electrocardiography conversion in addition to a IV anticoagulant like enoxaparin, 80 milligram bolus, followed by 1 milligram per kilogram every 12 hours. And hopefully this will convert the patient to a normal sinus rhythm. And we will monitor his 12 lead and to see if his sinus rhythm has returned to normal. His heart rate goal will be 80 beats per minute at rest and less than 110 beats per minute when exercising. After, I would also discontinue the patient's diltiazem because the patient has heart failure. We reduce ejection fraction. So I would not give a calcium channel blocker because it might make the heart failure worse. And again, we will monitor the same things as before. Then for prevention of future aflutter and for rate control and maintenance, I would give the patient amiodarone and amiodarone 150 milligram PO daily for rate control and prevention. Again, we will monitor the 12 lead ECG to check for sinus rhythm, heart rate goal of 80 at rest, and heart rate goal of less than 110 when exercising. Check for QT interval, make sure the R interval are equidistant, watch for hypertension, and just do the chronic amiodarone monitoring, and also check for electrolytes like magnesium and potassium, because if these get too low, the patient is at risk of getting another atrial flutter. And after the cardio converting the patient, we have to give the patient 4 weeks of anticoagulant. So I'll give the patient aspirin 81 milligram, 1 PO QD for 4 weeks after the cardio conversion to prevent clotting and prevention of embolic stroke. And I'll counsel the patient on signs and symptoms of bleeding. And after the 4 weeks of therapy, we would bring the patient back in, evaluate a CHAD score, and decide what to do from there. And we would also monitor the patient's triglycerol because it's a little bit high, but it's not over 500. So we wouldn't have to really give another medication, but just continuously monitor the triglycerol level because it is a risk factor that could contribute to a flutter. So a monitoring parameter for that could be a lipid panel for LDL, HDL, and that should kind of help reduce the risk. That is it. Thank you.